Thank you, HKLSS, for this opportunity to share with you all some of my experiences and my journey from a relatively academic background to now what I do is public policy research. So you can see on the slide, basically, it's an introduction of our Hong Kong Foundation. Um, our Hong Kong Foundation is a non-government, non-profit organization, but it's also a think tank. And I primarily do health policy research under the Public Policy Institute at the foundation. So a lot of people would then ask me, okay, so first of all, what is policy research? What does it entail? And second, how did you get from where you were? Basically, I have a background in science, and all the way into public policy research. So that's where I'll start, I guess. So I obtained my bachelor's degree at the University of Hong Kong, and I actually majored in food and nutrition science, and that has always been my passion, nutrition, because ever since high school days, I really enjoyed all the time I spent in that food technology course where we got to hop into the kitchen every now and then, and we created our own dishes. So I was very attracted to that area way when I was very, very young. And so I decided, food and nutrition has to be related to, kitchens and making food and everything. So I hopped into that course in university, and gosh, it was so different from what I expected. It was a lot of science, a lot of biology, chemistry, and yeah, it was very technical. And a lot of research in this particular major was very lab based. So I was exploring my interest between becoming a dietitian, a registered sort of dietitian, and practicing to give people nutritional advice, and versus a career in research. So what I had experienced then during my undergraduate studies, there was I remember a sort of summer course that allowed us to experience what food and nutritional science research was all about. So I ended up in a lab for I think at least 2-3 months, and doing a lot of work, lab bench based work, pipetting things and looking at cells through microscopes, and that in itself was quite an experience. But to me, I figured out through that particular experience the university offered me, that wasn't really what I had a passion in. And so, as much as I had a passion in nutrition and food and all of that, I was thinking, okay, I'm a relatively more sort of people or person oriented person. And so I looked for different opportunities. So, what can I do apart from becoming a dietitian and apart from, sort of being, doing lab based research? What other options were there? And then somehow when I was doing some research about what potential next steps I could take, I came across the term public health nutrition. So I was thinking, okay, that sounds nice, interesting, nothing I've heard of before, but it sounds like something that attracted me was better understanding why obesity is such an issue in the world, child obesity, and what sort of lifestyle behavior actually influences behavior, that influences the sort of like physical dimensions of health that then leads to, sort of um, different health outcomes, including obesity. And so I was very interested and fascinated in that area, like public health, what that was all about. And it seemed like, of course, even within public health, there's a branch that's, all to do with lab work. But, I sort of steered clear away from that and looked into another area, which was related to public health nutrition. And I ended up deciding to pursue a course at the University of Hong Kong also, but at the School of Public Health. And that was, I did my MPhil and PhD on primarily focusing on childhood obesity and its relationship with breakfast skipping, which was relatively, a new area at that time. And also, it's dietary related. So I found it quite fascinating to look at food and nutrition, or to do work in that area, lifestyle intervention, etc., from a public health angle. And after I graduated with a PhD, I then actually stayed within the academic field. I became a postdoctoral fellow, and I did a lot of work actually on a project to do with breast cancer patients and their dietary habits from the time they before they were diagnosed to the time they were diagnosed, and then they have their treatments, etc., etc. So to me that was also very interesting because it's also to do with nutrition, my primary sort of like passion right from the start. And so then obviously I'm sure as with Regina and Angela, I'm sure you would know that within academic field, a lot of focus is based on the research findings you get, and then publishing papers, writing grants, and that's all well and fine. But what I was curious about is how can we further translate the knowledge that we gain from our research into something that would what are the ways we can further impact society? And of course, publishing academic papers, of course, that's one form of it. But then I came across think tanks and public policy, and I was thinking, okay, how does academic or research itself link to public policy and policy making? What does that entail, and what is that all about? And so I decided to try to pursue, try out what public policy research was all about, and how we can really, on a macro level, influence behavior, well-being through policy making. And so that's how that was why I joined our Hong Kong Foundation. And then as you can see on the slide, our Hong Kong Foundation, even under the Public Policy Institute, we do a range of research on different areas in public policy: arts innovation, economic development, education and youth, land and housing. These are all under our realms, but I myself, I focus a lot on aging and health system policy research in particular. And just to share a little bit about, what is public policy about actually, right? So basically, well, what we see, sorry, excuse me, let me share that screen again. And okay, excuse me. Okay, and so basically what you can see, I don't know, I can't move. Okay, there you go. So the research, we focus, as I said, a lot on health policy and aging research. Three things we do primarily. One, we do a lot of research, policy research. Second, we do a lot of engagement with different stakeholders. And third, we do a lot of advocacy work. So I'll go through one by one quickly. So in terms of the type of research we do, as I said, I focus a lot on health policy research. So as you can see on the slide, throughout the different years, in the past few years, we've put out different research reports from, for example, the 2018 one we did on the entire health system of Hong Kong to review how our health system is faring under the pressure of a rapidly aging population and increasing prevalence of chronic illnesses, all the way to, say, for example, more in-depth studies like for example, in 2019, we put out a report that focuses on looking into the doctor shortage issues of Hong Kong and potential solutions. And to more recently, we looked into health financing and how we can propel primary care development in Hong Kong using a health financing lever. So as you can see, these are examples of the research reports we publish. But apart from just publishing the report itself, as I said, a lot of engagement exercise is actually is involved within the process of research and also post-launch of the report. And by that, what I mean is basically what we do is throughout the entire research process, we engage and listen to the views and perspectives of different key stakeholders within the field. Say, for example, from policymakers to all the way to sort of at the service delivery level. Say, for example, nurses, other healthcare professionals, doctors, etc., and also citizens. Representatives of non-governmental organizations, etc., etc. So we sort of try to understand their perspective on different topics that we're interested in. And from these different perspectives, we also integrate it with our desktop research, a lot of which is similar to academic research. We look at the literature, we look at policy documents to see the development of a particular area we're interested in. We try to analyze and merge all these different opinions to form useful policy recommendations that we then put into our report, we publish, and also afterwards we do more engagement so that we can actually continue our dialogue with the different stakeholders of the field to sell our ideas, but also again to listen to their feedback. So as you can see, engagement is a very important part of what we do. And as I said, the last part, apart from research, engagement is also, of course, the advocacy work we do, because it's no use usually just to put out a report per se. What to do with that report is the important part. For example, we do a lot of advocacy work on social media. So through videos, through social media posts, we write newspaper op-eds, we go out to the community to give talks at schools and at community level, and et cetera, et cetera. So a lot of ongoing advocacy work is just takes place all the time within our work. And so what's the point of that? So obviously we do hope to impact policy making in Hong Kong, hopefully best if the government adopts and listens to us, adopts our policy recommendations. But obviously that again doesn't always happen. And so for that, what we need to do, we usually give it patience, a little bit of perseverance, and keep going until hopefully one day the government will understand, how important our recommendations are. And obviously it's very evidence-based as well, what we do. And so all for the aim of really, for my research, bettering the health system for Hong Kong so that we can all receive quality and timely healthcare services. And so on this slide, as you can see, these are just some of the examples of engagement parties we do, such as, with political parties, academic exchange, government officials, etc. So we love to share our ideas and on different topics. And as with, the role of women per se, I would agree with, say, for example, what Angela said about that work-life balance, and Regina about the sort of, it's all about prioritization. I completely agree with that. That is also one of the major challenges I personally have. It's all about work-life balance. But also at the same time, within the working environment, I feel like it's fair to say that I feel very lucky that there's no real sort of differentiation between male and female per se. We all sort of have our strengths and weaknesses and uniqueness in contributing to the particular landscape of public policy research. And a lot of people usually ask me, what does it actually take to get into, for example, health policy research? Do I need a public health background? And the answer I've come to understand as I work, as the more years I work in this field, is basically the answer is you don't necessarily need to have a health or public health background to be a good health policy researcher. What a lot of teammates I have, they're really good. They excel in the field. They don't have any background in healthcare or health policy at all. But I think what comes with it is the passion towards really making things better for Hong Kong's health system. As I said, the perseverance as well. So not being let down by sort of, for example, if the government doesn't end up adopting our recommendations, it's all about, sort of keep on going, advocating perseverance and the patience that we have towards the whole entire policy making process, with the hope that one day, again, what we do directly will contribute to a better health policy landscape in Hong Kong and a better health system for our citizens. And so I'd like to highlight one of the things I personally enjoy the most about what I currently do, or what I find the most rewarding, and that falls into the realms of engagement with different stakeholders. As I said, it's one of the core aspects of our work, and I feel like I'm very lucky to have the opportunity to talk to different stakeholders of the field. As you can see, this is just the slide shows a simple representation of the people we meet, and to listen to different perspectives from the social sector, health sector, academics, etc. and to listen to the service users, what their feeling is towards, say for example, Hong Kong's health service, really makes me feel like it really gives me different perspectives and allows me to learn a lot along the way, be it from the academics, be it from citizens, and I'm lucky to be sort of in the position to understand all these different perspectives, and from there to be able to try my best to come up with some useful policy recommendations from Hong Kong. So for me, it's definitely the engagement that really satisfies me in the whole entire process. So I think with that, I'll just end this short sharing here. And of course, I look forward to the discussion that is coming up. Thank you.